Good morning, good afternoon, good evening, wherever you are. My name is Ashley Howard. I'm Senior Manager for Data Evidence and Policy with Together for Girls. Thank you for joining us today for the launch of the Violence Against Children and Youth Survey Data Dashboard. Thank you to the Children's Investment Fund Foundation who provided funding to make this dashboard possible. For your information, this session will be recorded. Translation into French and Spanish is also available. To listen to the language interpretation, please look at your meeting or webinar controls, click on interpretation, which should be a globe sign, click the language you'd like to hear, and to hear the interpreted language only, you can click on mute original audio. Those instructions will also be available to you in the chat. If you'd like to introduce yourselves, please do add your name, affiliation, and the country you're from or the country you're in the chat. And without further ado, I'm pleased to introduce to you Daniela Ligero, CEO of Together for Girls.
Daniela Ligero, CEO of Together for Girls.
Founder of the Brave Movement.
Y fundadora del movimiento.
I think we have a little bit of an echo, Ashley. I don't know if others can hear. Sorry, everyone.
I think the issue why it's like that is that we haven't been assigned, and Grace is trying to speak over like the speaker. So we have to be assigned as interpreters.
Okay, so why don't we ask for that to be resolved while we get started? I'm going to start, and if we could not do the interpretation just for a moment, that would be great. Thank you so much. Okay, sorry about that. A los que hablan español estamos teniendo un pequeño problema con la interpretación en español. Esperemos un par de minutitos que están tratando de solucionarlo, pero lo voy a empezar en inglés. Perdón a todos y todas y bienvenidos. All right. Welcome, welcome. Today, we are so excited to be launching the VACS Data Dashboard. As Ashley said, I'm the CEO of Together for Girls, and I'm delighted to be here with a group of phenomenal leaders to talk about the importance of data to drive action on ending violence against children. We know from the research that 1 billion children experience some form of violence every year. And we also know that 1 in 5 girls and 1 in 7 boys will experience some form of sexual violence before their 18th birthday. And one of the reasons we know this is in part because of population-based surveys like the VACS. Population-based surveys are really essential to getting this kind of big number and really understanding the magnitude of the problem outside and in addition to other forms of data gathering like administrative data from health and justice sector, which capture only a piece of the challenge in terms of those children who are seeking services. And the truth is that data are really essential to inform decision makers, policies, government action. And we're very excited that we're going to be hearing from government representatives from Kenya and Uganda today about how data is being used to inform policy and programmatic intervention there. And data is also essential for advocacy, for survivors who are demanding that leaders do more on this issue, like those who are part of the survivor-centered Brave movement. And thanks to the VACS, the Violence Against Children and Youth surveys, which are led by national governments with technical support from CDC as part of the Together for Girls partnership, we understand the magnitude of the problem better than we have before, the context in which it occurs, the risk factors, the protective factors, and ultimately we can better tailor the solutions to meet the real needs of children and youth, which is what it's all about at the end of the day. And so today in launching the VACS Data Dashboard, we are making 18 years of VACS data accessible to anyone with a smartphone instantly, no matter where you are in the world, to help inform programming, advocacy, and of course, research. Ashley already said this, but I want to take another moment to thank CIF, the Children Investment Fund Foundation, for helping to support and fund the launch of this dashboard, as well as WHO, who is helping us do this event here today. And of course, the CDC has been a longtime partner, and all of our panelists who represent governments, researchers, advocates, who are an essential part of making the VACS a success. And just a few closing words. I think in a moment of retrenchment and global austerity. It's a tough moment right now. We absolutely need to find creative ways to continue collecting data through new approaches, to really make sure that we continue to have this essential information to drive action, to drive evidence-based programming. And our children cannot afford to lose this now. Thank you finally to the thousands of children and youth who have participated in VACS over the last 18 years, have shared their lived experience to help us better understand what it is we need to do as leaders to ensure prevention, healing, and justice. And so with that, I'm happy to pass it over back to Ashley. Thank you.
Thank you so much, Daniela. And I'd like to welcome Etienne Krug, Director of the Department for Social Determinants of Health at the WHO, who will provide some scene setting for our webinar today.
Thanks so much, colleagues. It's a pleasure to be here for the launch of this very important new tool, the Violence Against Children Survey Dashboard. And congratulations to our colleagues in Together for Girls and all of you who worked on this. Daniela just said everything I was going to say, so I'll be very brief and totally agree with what she said. I've been around for a long time, a time actually from before the VACS existed. And it was a struggle to make a solid case for tackling violence against children. The Violence Against Children surveys have been a game changer, and a big thanks to CDC, also UNICEF and Together for Girls and all the partners who worked on these tools. They've been super important. As Daniela said, important for advocacy, important for understanding the problem, important to set priorities for action, and we need to recognize that. But not always easy to use, and having this new dashboard, I think, will address that a lot. It's great to have data, it's super important, we need data, but sometimes our data is very complicated for policymakers, it's very difficult to use for civil society, etc. And this new dashboard, I think, will do the trick. So I'm really happy to celebrate this new tool with all of you and encourage everybody to disseminate it. And I want to finish with a plea. I think it's terribly sad that in the world we're in, where many policies are being decided that we know are actually the opposite of what we want to see to diminish violence against children, to reduce violence against children, in a world where we will see a rise probably in some countries of violence against children, we need data to show it, we need data to analyze the changes and to be able to take action. And the fact that the Violence Against Children surveys are not continuing is really detrimental. So I hope we have people online who are able to fund or to step up to the need of continuing the Violence Against Children surveys, because we need them. They are an essential tool of this field. Data is an essential tool of every field, and having the possibility to continue these surveys would be extremely important. But again, congratulations to all who worked on this dashboard. It's fantastic. We're launching it today and looking forward to the discussion. Thanks to all.
Thank you, Etienne. Next, I'd like to invite Greta Massetti, Principal Deputy Director of the National Center for Injury Prevention and Control at the U.S. Centers for Disease Control and Prevention, to give us a bit of background on the VACS. Thanks, Greta.
Great. Thank you so much, Ashley. And thank you to Together for Girls and to all of our partners for hosting this webinar and for inviting me to participate. I'm going to start with a story. In 2007, VACS really started out of a need, a desperate gap, a need to fill a desperate gap for data. The government of Eswatini and UNICEF at the time were really needing to answer a fundamental question about the scope of violence against girls in that country, and did not have data, and they fundamentally wanted to use data-driven approaches to be able to prevent violence. And that's when they approached CDC and asked this question about what can be done. And that was really the birth of VACS. It was intended to be a one-time survey in one country. And it was such an inflection point for the country and was so transformative. The availability of data, comprehensive data, not just on the prevalence of violence, on the context, understanding who is most at risk, who are the perpetrators, where is it happening, what are the consequences. It allowed the voices of young people, and particularly the voices of survivors, to come through in a real way. The ownership of the government was also absolutely essential over the survey to ensure that the government was committed to conducting the survey and using the data to inform their program and policy action. That transformative experience for Eswatini was so impactful that many countries started to turn to CDC and asking, we want this too. We want this survey. We want this information. We want to hear from our young people. What can we do? And that has really grown over the last 18 years. We have conducted over 27 surveys. I had the opportunity to return to Eswatini many years later as we were planning the second survey, and I heard directly from individuals who had been involved in the first survey, who came to us, and they were quoting exact data points from that first survey. The prevalence of violence was this, exact to the decimal point. They had lived that survey and its results in such a real way, and they could point to exact policy changes, programmatic initiatives that they had used the data to inform. When we repeated a survey in 2022, we found significant reductions in the prevalence of all forms of violence against girls in Eswatini. And that was not the only country where we've seen declines. We've repeated surveys in Kenya as well, and in Zimbabwe, and we've seen declines as well. Because really ultimately the benefit, the value of the data is not because they're interesting or not because they just tell a story. It's because they are made accessible to governments. They allow governments to speak their voice and demonstrate leadership and an ability to use evidence-based, data-driven action to prevent violence against children and to really put children and survivor first to ensure that the well-being and the well-being of young people in their country. So the other thing that these data provide is information as a global good to the world. They have really enabled advances in evidence and data and research and science. We also have really built an understanding of the epidemiology of violence against children using these surveys through scientific advances, through data-driven action. So this dashboard, what is really essential about it is it's the next stage of really making data accessible and putting it in the hands of users of all forms, whether it's a young person, whether it's a policymaker, whether it's a researcher, whether it's a community-based organization using the results to write a grant application to build on that work. So that is really the exciting next step. A fundamental component of public health approaches is really to ensure data transparency and to really advance the availability of data. And we are so excited that this dashboard does that, not just in a transparent way, but also in a way that is truly beautiful and really does justice through its visualization and interactive aspects. It truly does justice to the nature of the data. So before I close out, and obviously I'm very passionate and excited about this dashboard, I want to say one more piece, and that's a key component of VACS. The surveys have been not just about violence against children, not just about the context, but about all of the experiences of young people. We capture data on access to education, sexual health and well-being, positive relationships with parents, with community members, with family, with peers. We really are are using this data, the governments are using those data to tell a complete story about the experiences of young people. And that's what you'll see in the dashboard as well, so that we're not just focusing on what are the aspects of violence that are kind of standing in the way of young people's opportunities to thrive in countries, but also what are the ways we can strengthen their health and well-being and support their opportunities now and in the future. So I really want to thank Together for Girls for their leadership in this. It's been such an exciting collaboration. We've worked together for so many years on the data aspects and on the supporting countries aspects. And I think this is really going to be the next level in building on this work. So back to you, Ashley.
Thank you so much, Greta. I'm now delighted to introduce Constanza Ginestra, Research and Policy Specialist at Together for Girls, who will now show us the dashboard. Over to you, Constanza.
Thank you so much, Ashley. It's an honor for me to be here to present the dashboard. Chrissy, will you please share the slides? Thank you so much. Here we are. All right, so as Greta already mentioned a little bit, the VACS are the most comprehensive global source of data on the prevalence of violence against children and young people, on risk and protective factors, consequences of violence, and on disclosure and service seeking. As of now, the VACS data can be found in country reports, in fact sheets, and in research articles. Also, for those interested in working with the raw data, public use data sets are available to request at our website. However, we believed that to ensure prevention and response to violence are informed by evidence, it is critical that VACS data is available to a wider audience, including, as Greta mentioned, practitioners, policymakers, activists, and the media. And I will say that was the main reason for which we created the dashboard. So this dashboard is a comprehensive tool that simplifies access to VACS data for 21 countries. It is simple, interactive, intuitive, and fully functional in low bandwidth settings. So while using the dashboard, users can easily filter through hundreds of key data points by type of violence, by country, by gender, by age group, generating different graphs and tables that can be downloaded in multiple formats and can be used, for example, for slide decks or social media content. This table on the right shows you the topics that you can find in the dashboard. You will see that there are indicators on background characteristics such as education or disability, also on prevalence of sexual, emotional, and physical violence, but also, as I mentioned, on the context of violence, like perpetrators, location, and disclosure, access to services. You'll also see that there is data on school-related gender-based violence, on the Inspire framework. So it is, as it was already mentioned, very, very comprehensive. Next slide, please. So how we created the dashboard. This project consisted of 5 main stages. The first one involved interviewing stakeholders from different countries to learn what they were expecting from a tool like this. After that, we start thinking about the the dashboard, as you saw in the previous table, verifying the data's accuracy. And finally, we have the build and delivery phase, which was in charge of a development agency. So the current version of the dashboard, as you will see now, includes more than 100 indicators and more than 5,000 individual data points. We wanted the dashboard to be as great that helps inform policy, translate complex data into accessible insights, and also a tool to support research we wanted to. And now I'm excited to take you through a quick demo of our dashboard. I will share my screen. Let's see. Yes? Can you confirm, Ashley, are you seeing my screen, please? Okay, thank you. All right, so you will see here the dashboard. On the left, we have all the different topics I was just mentioning to you. And below, we have the countries. So I will start with sexual violence in childhood. We should see all the different indicators that we included under sexual violence in childhood. I'm gonna look for prevalence of sexual violence, as I mentioned before, and you can see here the data by gender and by the two different surveys. If you click here on the 3 lines, we can download this chart in many different formats. We can also download here the data that is included in the table. And you can also embed this chart in a website, for example. All right, we can see here the difference, right, between the prevalence of violence against children in the first and the second survey. All right, let me show you another example. I will clear here and go to disclosure and service access again for Kenya. We'll see here the comparison between the two, between genders and between the two different surveys. Again, if you click here, you can download this chart in different formats. And you can also download the data that it's included here in the table. All right, let's move to finally a different, I will clear here and clear here. And let's see another country and another indicator. For example, let's go to perpetrators and in Colombia. Look.
Constanza, I think we're having some challenges with your connection.
The different indicators. I think my internet.
Yeah, Constanza, I think we can have Ashley come in and demonstrate the last indicator if that would be helpful. Sorry, folks, such is the nature of a global webinar, right? Internet connections vary and are not always reliable. Thanks for your patience.
All right, let's see. Can you see my screen properly now, Christy? Okay, so I'll just show what this last example that Constanza is going to show, perpetrators of sexual violence in Colombia. So perpetrators of the first incident, we have multiple different graphs you can see by different, you can toggle between males and females. Here, I'll just look at females, and you can see that the largest number of perpetrators, or the highest proportion, were friends, classmates, or neighbors, followed closely by family members, other people, which is just a catch-all category, or intimate partners. So this is just an example, again, of the types of data that you can see. And again, there are 5,000 data points. These are not individual people, but they are individual data points per country data in the reports. And then Constanza, do you have the case study up on your screen? Do you want to try to share that?
I can try, Ashley, but my internet is not working well today. Let me try. I will try.
I will pull it up. And maybe Constance, you could try to even turn off your video. Let's see. Here, I'll go ahead, Constanza.
Thanks, Ashley.
So this is just an example of how the dashboard can be embedded into a case study or into a website of any kind. So this is a case study from our Safe Futures Hub. This is a program called Linnea that's been done in Tanzania. And we have the embed popping up here of the dashboard. So it can be brought into websites just as a nice communication tool. So that is basically the intro to the dashboard that we wanted to provide. And I'd like to go ahead now and introduce our panelists. I think we're waiting on one potential panelist to join us. So if she does, we will introduce her at that time. But we have 4 incredible panelists with us today who will share, who will exchange ideas with us. Vivian Mangoli is Principal Children's Officer of the Directorate of Children's Services, the State Department for Social Protection and Senior Citizens Affairs at the Ministry of Labor and Social Protection in Kenya. In 2010, Kenya became the first country in the world to conduct a VACS among both girls and young women and boys and young men following the Eswatini VACS in 2007 that Greta spoke about. Under Vivian's leadership, Kenya became the first to conduct a repeat VACS in 2019 alongside significant qualitative research that she spearheaded to examine factors associated with significant declines in prevalence in the decade between the first and second VACS in Kenya. And we have Chichi Undi, who is Technical Director and Senior Associate at Population Council in Kenya. She's also Research Director for the Baobab Research Program Consortium, which implemented the first VACS conducted exclusively in humanitarian settings in Uganda in 2022 and in Ethiopia in 2023 with UNHCR and under the leadership of national governments. And we have Arturo Harcaroa, Associate Professor at the School of Government and Director of the Imagina Research Center at Universidad de los Andes in Colombia. His research in Latin America focuses on the impact of adverse childhood experiences, including exposure to violence, on the development of cognitive, social, and emotional skills. And finally, we have Stuti Tripathi, who is Director, Program Performance and Impact, Children's Investment Fund Foundation. Stuti has dedicated her career to the generation of high-impact evidence to inform change and has been a key champion to bringing the VACS Data Dashboard to life with funding through SIF. So for Vivian and Arturo, we'll start with you, Vivian. We'd love to know, what is your country, what is Kenya, Vivian's proudest VACS Data to Action achievement and its impact? And I think we're doing well on time, so if you can take up to 3 minutes to answer that. Thanks, Vivian.
Thank you, Ashley. I've already been introduced, so my name is Vivian, and we are proud as Kenya because ever since we conducted the second VACS survey in 2019, we were able to develop a violence against children prevention and response plan that was multi-sectoral in nature. The actions, the strategic actions that were contained therein were multi-sectoral in nature. It involved people from different sectors that came together and looked at the data, and we came up with strategies that were aligning to the INSPIRE framework, and that informed our plan to end violence against children in Kenya. We were to implement that plan between the year 2019 to the year 2023, and we are currently revising it. So what did this do for us in this country? Normally, we implement our programs through with a goal of attaining Kenya Vision 2030. And Kenya Vision 2030 is implemented through the medium-term plan. So in our medium-term plan 4 for the first time in this country, we managed to include prevention of violence against children. And that was a program to, violence against children program on prevention of violence against children in the medium-term plan 4 that is currently being implemented. And that is because we had data in place. It is very difficult to get into the medium-term plan if you do not have statistics to back that up. And for the first time, we have been able to achieve that. What does being in the medium-term plan entail? It means that now you have justification to be included in the budget. So in the national budget, now you can make a case for yourself that we need funding because this is the situation that is facing our children in our nation. And using that justification, we use the VACS survey data, and that is what we were able to, that is how we were able to get into the medium-term plan 4. So currently, the many actions and the many strategic actions that are in the plan are getting in the national budgeting because we envisioned this in the National Prevention and Response Plan on VACS. So it is exciting to see that all our efforts are actually translating to domestic funding, which is something everybody is envying right now that the international funding has gone way down. And we appreciate the fact that we were able to do this. Another achievement that I can talk about and we are proud of also is, apart from just ensuring that we have domestic funding in place and we have put mechanisms for that, and now we are just advocating that we want increased funding towards or increased resources towards VAC prevention and response. We also managed to enact the Children Act 2022, which was a plus for us during that period in time, because apart from outlining penalties in different areas of child protection, it also gives structures that we needed to implement children services, which have great impact in reduction of violence in our country. So it has created different offices. When I say offices, I mean it created the structures, Directorate of Children's Services, where functions of children's services are being implemented from. It also created room for access to justice for children. It also has created an opportunity for programs to be implemented by different structures. And one of the most important one is on coordination. There's a national body that is supposed to coordinate children's services in the country. And this is very key because of the fact that for you to be able to reduce violence, you need to work together. And that is a plus for our country. And we are very proud of the fact that we have been able to enshrine even the multi-sectoral collaboration in our legal documentation, our legal policies. So that has improved our policy environment, and which means even coordination and coordination of sectors and coordination of programs and activities can be funded. And that is something we are very proud of. Thank you, Ashley.
Thank you so much, Vivian. The examples you've provided are so powerful and can really teach us all so much. I'd love to ask you, Arturo, to answer a similar question. In your country, in Colombia, or in the Latin America region, can you speak to what you see as the most important achievements and impacts of the VACS data?
So thank you for having me here. I'm really happy to have this opportunity to share our experience around the VACS studies. So I would start from the beginning. I think we're really proud of having a VACS version in Spanish that is implementable in all countries. We had the opportunity to work on the translation and adaptation of the VACS to Spanish and to the Latin American context in 2015, doing a cognitive lab, and that was a great experience. And maybe that start of working on building the infrastructure to do the study had a very important shift in Colombia. I can speak for Colombia in this case, that before the topics on prevention of violence against children and measurement and were completely siloed in the health system. No, there still is a very strong group working from the Ministry of Health around that topic. They facilitated the implementation of the VACS. They were in the group that helped a lot there. But when we did already the study, an important thing that happened is that the going from the data to the action was more explicit that we needed like a multi-sector approach. So, for instance, the leadership around how to prevent and eventually end violence against children in Colombia became some flagship project for the Family Welfare Institute, which is the government agency that has to coordinate all efforts around child welfare and protection. So that was really, really important for the country to have someone that has, by law, the mission of coordinating all actors around these topics. That they got like that leadership hat around ending VACS. So that's an important thing, and also, well, just starting having public policy using population-based studies, meaning that we have samples that really represent the whole country. That was like a complete shift, not only for Colombia, for the other countries in Latin America and the other 20-something VACS. Before that, we only spoke about prevalences that were way off. We know that the administrative data on reported cases there's a serious bias. Not only in terms of obviously the cases that like get reported and go through the systems, but also that the information that we have about the nature of those cases is completely biased. So it was something very important too, after having the VACS, starting this journey into having a political commitment. Having this data showed a lot of sectors had different ministries sitting together and seeing their responsibility, or actually not responsibility, but there was a space for them to help, was very, very important, and having information then to do something. And yeah, I think that we are not at the same stage of having a second VACS. I wish that that happens soon. The first one we did in 2018. But yeah, having a national action plan and having this multi-sector engagement around the topic is really, really important. Thanks, Ashley.
Thank you so much, Arturo. It's wonderful to hear how VACS has kickstarted so many conversations there in Colombia and in the region. Next, we'd love to hear from you, Chichi. Having worked on VACS data action in Kenya, Uganda, Ethiopia, and beyond, what do you see as the most important impact of VACS on efforts to end violence against children and youth in those countries or globally?
Hello, I hope you can hear me. Thank you, Ashley. Well, I could go on and on. I know I only have about 2 minutes. But let me just say that when I think about the issue of violence against children, I think about a hugely complex issue that's really overwhelming to tackle. And in my experience, the VACS, which isn't just a survey, I hope that, from the interventions of previous speakers that we can see that it's beyond a survey alone. The survey is just the beginning. And I see the VACS as being an important starting point for generating the information that countries need. And if countries are doing it for the first time, then that means there's a whole lot that they don't know, and that there's a whole lot of information that the VACS brings. Another important part of the process, which I think Vivian alluded to, is the data to action workshop that is linked to the Violence Against Children survey results. We've all been for a million workshops, I'm sure. I have never been part of a workshop that's as systematic as a data to action workshop. This is a workshop specifically designed for the Violence Against Children survey, and it involves working with the relevant stakeholders to consider the data that has been generated and come to consensus on what their priorities are. So you can agree with me that this whole process sort of leads you to a point of really getting stakeholders to coalesce around the solutions that they want to implement within country. And once that consensus is achieved, it really leads to what Vivian described in Kenya, for instance, as this collective action, really. And it is meant to culminate actually in a national action plan. And so all of these things are quite systematic, so that partners don't have to implement in the dark or implement by intuition. They actually, can get a handle on what the problem is, what the magnitude is, what it is that they are ready to do about it as a group. And so for me, that really is, what leads to the actual impact. And I think, Kenya is just a wonderful example of, what can happen when you have the chance to do it, not once, but to do it again and really see how far you've come as a result of the action plan that has actually been implemented.
Thank you so much, Chichi. Stuti, we'll turn to you next. As a global leader in the field of data to action, what do you see as the most important use of the VACS data and evidence in general in the prevention and response to violence against children?
Thanks, Ashley. And I think I'd also like to just begin with congratulating Daniel and the Together for Girl team for sort of putting this together, such important and critical piece of work. I know 2 years back when we first started talking about this work, and it's great to see that it's finally seen the light of the day, and we have so many people globally engaged so enthusiastically on something that we began over 2 years ago. But going back to your question, Ashley, on why this is important, I think the speakers before me have sort of spoken very eloquently and persuasively about why we need this data. But maybe what I can highlight a bit is about what got CIF excited about this project. So as a philanthropy, we are a very data and evidence-based organization, and we work on a range of issues that affect children. So it's health, it's education, climate, and various other issues. And importantly, we also work on child protection. And being a very data and evidence-driven organization, what we realized was that when we wanted to frame our strategy for child protection, there wasn't just enough data out there. I think as previous speakers have spoken, that either the data that's there, it's very underreported, or it's just absent. And I think that for us was a trigger for knowing that why this was such an important project to sort of invest in. And to me, I think the way the dashboard and the VACS survey has turned out does a few very important things, which I think, as Chichi just said, are important precursors to the next steps. One, I think for us, it really brings out what the enormity of the issue is and how pervasive it is. I think as a society, sometimes we can be in a state of denial and not recognize the kind of violence that children face. And sadly, so that children don't really have the agency to sort of articulate it for themselves. And not having this data, I think, was leading to a lot of inaction, which now we can also hear from how Vivian just said that, when you have data, it's very hard to ignore and you're pushed into action. And it's very heartening to hear that for some of the reasons why we invested with Together for Girls, it's sort of leading to the kind of impact that we had hoped and anticipated. I think the second big thing for us was that, there are people who are very, who feel very passionately about the issue of violence against children and for child protection. But once the data is out there, you actually build new champions, you convert people, you realize that it's because people begin to feel that, okay, so like health has got traction, education has got traction in the development narrative, and child protection and violence against children has not so much, primarily because the data has not been available to the extent it is there has been in other sectors like health and education. And I think building new champions, like expanding this field, trying to make child protection everybody's business, is an important, and data I feel is an important step for us to be sort of doing that. I think another important thing for me, and maybe that brings my measurement lens, is that it also gives us a common language to talk about violence against children. It's a very broad term, and sometimes it can mean very different things in different cultures. In some cultures, certain kinds of violence can even be seen as acceptable. So I think this kind of a framework, which is global, and a dashboard that's global, that sort of in a harmonized, consistent way tries to capture what is the instance or what is the enormity of the issue of violence against children. It gives a common indicator or a common benchmark for all countries to work towards. So, it's not about saying that, oh, well, in my culture, this is acceptable, so I don't care. But, there is a common benchmark where countries can sort of compare and see how they are doing against each other. So it helps them set a goalpost for themselves. It sort of creates a shared narrative and a shared framework against which everybody can be sort of measuring themselves. And I think, as previous speakers have also mentioned, that once you have something like out there, it facilitates cross learning, because we have, as development sector practitioners, we may be working on an issue, but working on it in a very siloed way, or with a siloed approach, just trying to solve it for our own country, and thinking that, well, this is a unique part of our country or a unique problem of our country. When you actually have something that's cross country, and you are able to sort of put it in a global perspective, you also realize that there are similar challenges that people in other contexts and other countries are facing, and that in itself gives a good chance and a good starting point for sort of initiating that cross learning. And I feel I feel this dashboard is really a beautiful platform that can sort of bring all of those action together and sort of help move this field. And I think, as Chichi just said, that this is literally the first step that we are taking, but this was an absolute essential precursor to get us on that journey, on that path, where we now start working towards solutioning for these issues. And now that we have the data, we are sort of putting it out there. It's very hard for anybody to ignore it. And it will propel people who are in the decision making positions to sort of do something about it. So yeah, I think I'll just pause there. But once again, many congratulations to the Together for Girls team for actually putting this really important resource together. Thank you. Over to you, Ashlyn.
Thank you so much, Stuti. This global framing is so powerful. Vivian, we'll turn back to you for a second question now. It was incredible to hear from you about the power of the VACS, the first and the second VACS in Kenya, and changing the conversation there. We'd love to dive a little bit deeper into the qualitative research on factors associated with the steep declines in violence against children between 2010 and 2019. What learnings from that qualitative research would you want to share with other countries, Vivian?
Thank you, Ashley. So we are among the countries that are privileged to have conducted 2 VACS surveys. And from data that the prevalence of VAC actually reduced from the data that was gathered. So what learnings do I want to share? When we conducted the qualitative study to find out why it declined, there were various factors that led to that decline, but I just want to share about 2. So we had government leadership. There was leadership and coordination and collaboration. Government leadership was exhibited through ensuring that we have conducive policies across sectors that were speaking to child protection. In my country, the there are many line government ministries that have a component of child protection that is being implemented. And so there was need to ensure that we know who is doing what where and how can we work together to ensure that we are not working in silos. And this coordination and putting in place a child protection framework really assisted in ensuring that we put our efforts together and we leverage on the resources that are available to just prevent and respond to violence against children. Another thing maybe I want to share is the fact that there was system strengthening in terms of the workforce. There was increased workforce recruitment and also capacity building of this workforce to ensure that the services we provide are of quality services, and also getting to reach a wider audience with the services that we were providing across sectors, in the justice sector, in the education sector, and also in the social sector as well as the health sector. So ensuring also that we are collecting programmatic data was one of the things that led to this reduction of violence. So there's a system that was established in the health ministry, the Kenya Health Information System, that was able to help us collect data and see, even as we are implementing and offering services to children, how are we doing? And, you know, during the VACS survey, you saw the report that just a little number of the survivors were reporting what is happening to them. And so this programmatic data is also able to show us the magnitude of what is happening real time. And apart from the Kenya Health Information System, we also have the Child Protection Information Management System that is accessible to government and non-state actors, are all supposed to feed the case management that they are doing on survivors of violence in various areas. So I think combining the fact that we have the manpower to provide the service, and we also have a coordination system in place, and also ensuring that we have the capacity, the skills, that this manpower is skilled to provide the service, and that we are monitoring what we are doing, is something worth sharing. And maybe countries can pick that up, because without coordination and monitoring of this, and also capacity building your workforce, it's very difficult to implement. But apart from that, maybe lastly, I can just add a last one, is that there was also increased funding at household level and also at the system level, because the government also invested a lot in ensuring that they keep children in school through bursaries and things like that, and also just putting in place programs that were improving the household economic status through the many welfare funds that are available and the cash transfers that we have. Thank you, Ashley.
Thank you so much, Vivian. Chichi, we'll turn now back to you. Chichi, you've worked hard to ensure the VACS shed light on the experiences of some of the most hard-to-reach children. Have any of the VACS findings in humanitarian settings surprised you? And has the VACS data to action process actually changed anything for these populations?
Thanks, Ashley. Yes, I did receive some surprises. Again, as I believe you mentioned, Uganda is the first country to have conducted a VACS exclusively within humanitarian settings. I think there may be two things I wasn't quite prepared for. And once again, in Kenya, the VACS that have been conducted have been, carried out in development settings. So I guess I wasn't prepared to see the striking similarities, the different, the patterns sort of were consistent, whether you're talking about doing this, in a development setting, or, in refugee settlements or refugee camps, as we have in Ethiopia. they're very similar patterns, even though, the figures may not be exactly the same. And then, we conducted this in refugee settings in Uganda first, and then did the same in Ethiopia in refugee camps. The patterns between those two were very similar, and having to do write up the results, within not so long intervals of each other. It was almost like if we were writing the same report again, So that's one thing. And out of all those patterns, I think what always has stood out for me are the levels of disclosure. So children experience sexual violence, and when they do, they don't tell anybody. It's not a new story from all the VACS we've done in other countries, but it's still chilling with the 3 countries that I'm looking at right now: Kenya, Uganda, Ethiopia. The rates at which children do not tell, anywhere from 60 to 85%, depending on gender, the specific country context, and so on and so forth. But that's a huge proportion of children who have not disclosed to anyone. And then when they do disclose, patterns we see throughout these countries, including Kenya, is that a very small fraction of those, right, who do end up disclosing, end up receiving the care that they require. And that's anywhere from 2 to 28%, again, depending on gender, depending on the country context. So these are very dismal figures. Given how striking they are, it's not surprising that, during data to action workshops around this in humanitarian settings, stakeholders have been struck by this as well, and have often, among the priorities they've selected, they have often pinpointed, the issue of disclosure and the need to provide support to children to disclose, and the need to provide support to children to obtain services. Yeah, so the lesson for me is, if you build it, they don't necessarily come. And I know that there's been a lot of action around, one-stop centers, sensitization, making sure the services are available, but getting children there. And if we really think about it, it shouldn't be so shocking, because I think even for adults, health facilities and those kinds of services can be rather intimidating. And so we can imagine that for children, they need special support in order to access the services that we have set up for them. I think it's also really important to note that, given that priority in Uganda, again, I'm talking about the humanitarian sector, responding to the results of the Violence Against Children survey conducted in humanitarian settings, they have really prioritized this. It's a pity that Lydia from the Ministry of Gender in Uganda wasn't able to be with us today, but they really are, in partnership with the Department of Refugees, the Office of the Prime Minister in Uganda, they have spearheaded and they are running with a particular intervention that really helps promote disclosure among children and helps support them to ensure they don't fall through the cracks and do end up where they need to go to obtain services. And I think, to add further to the excitement around this, it's interesting to see that in Ethiopia, they have been eager to learn lessons from Uganda. And I'm referring to the Refugees and Returnees Service within Ethiopia, which is the government body that oversees the care of refugees, and they've had exchange visits with the government of Uganda to really learn lessons around this particular intervention, and they have taken it up themselves as well. So these are just a few examples as well of what can really happen when you do a survey that's not just a survey, but one such as the VACS, which is linked to action, is linked to evidence-based interventions, is linked to stakeholder consensus, and so on and so forth. Thanks, Ashley.
Thank you so much, Chichi. We'll turn now back to you, Arturo. What advice would you give to users in VACS countries who are unsure of how to use the data in the VACS Data Dashboard to inform their programs or advocacy initiatives?
So, yeah, I may take this opportunity to congratulate the team behind the dashboard. Sorry. it's a great initiative. There are several ways where that's the data could be used. I may have like 3 specific advices. So the VACS provides something very important. That is, we have talked about it. That is the opportunity to have prevalence rates more than the other rates of like the observed cases. We can talk about the nature of violence against children, but also in terms of the risk and the protection factors, in terms of the characteristics of the victims, the perpetrators, the reporting biases. That's really important. And the important is that this data is actionable. No, we can better read the localized administrative data because it helps us understand the biases, who is not reporting, what are the characteristics of the people that do report in comparison to the ones that don't report. So that's very, very important. It also helps us to better design prevention strategies. I can give you one example. In a study that we did using the VACS for 16 countries, we wanted actually with the publicly available data on the VACS or from the VACS surveys, we did this study and we found very powerful information that informs prevention efforts. We found, just to mention one, that in these 16 countries, approximately half of the adolescents who reported they had been sexually abused as children, they reported that the first occurrence happened before they were 13. So this really gives you an idea of where should the efforts be targeted to. A second advice is that in the advocacy initiatives, and I know Chichi mentioned this, the data to action workshops are really, really powerful. And those are like, it's a key catalyzer to be able to take advantage of the VACS studies. And in these efforts, it's very important to include all sectors that provide services for children and families. In Colombia, we have the health sector, protection of family welfare, the police, the justice system, and we didn't have at that time full engagement with the education sector, and that we carried that like that limp for a long time because they weren't engaged, and the VACS provides key information that talks to each sector. Thus it is designed, and there are tools to interpret the data in terms of what should be done from where, from which agency. So it's really, really powerful. And finally, one advice is the engagement that you do using this data should be done at different levels of the government. National level, it's like key, very important. But if you don't do it at a more localized level, like in lower levels or smaller levels of government, you are going to be there's big risks there. First, because prevention strategies like the implementation of the actions should be contextualized, and it's better to have locally grown things because they are more impactful and they're more sustainable. And also because when you don't do that, when you don't have that local engagement, you're like a drifting ship that depends completely on political cycles, meaning that if you're working with local governments but they're also national level governments, political cycles are less of a threat on making like the whole initiative around violence prevention have like sudden stops or getting those cycles moving along. Again, it's much easier if you're working at those different 2 levels. So that would be my advice, Ashley.
Thank you so much, Arturo. Excellent advice. Stuti, we will turn now to you. SIF, of course, has demonstrated significant leadership around the first ever global end violence against children ministerial, which resulted in unprecedented commitments among member states to implement concrete actions to prevent and respond to violence against children. Many of those commitments focused on national data collection efforts to facilitate evidence-based decision-making and implementation. Can you share a little bit about how SIF is thinking about this new challenge around data, given the impact of declining development assistance and institutional investments?
Yeah, thanks a lot, Ashley, for that question. And yeah, it's a very, very tricky question to respond, honestly. We are, as we all know, recognize we're in an extremely unfortunate and very unprecedented situation. I think the kind of cuts the sector has faced has disproportionately impacted the work of the sector, the plans, and the fact that suddenly organizations are having to rethink their work plan, reprioritize, and it's reprioritization is a very difficult exercise when you know that every issue that you're working on is so critical. So yeah, I think honestly, given the recent developments, I won't claim that SIF has already has a clear plan in terms of how we are going to be tackling this challenge or how we can be supporting the sector as a key stakeholder and along with other development practitioners. But I do feel that there's a clear recognition of there being an important gap to fill. We also understand that no one organization, including SIF, can sort of probably plug that gap. That said, we are in an early brainstorm stage, both internally as well as with our partners. We've also been speaking to Together for Girls as well, to see that where is it that we can best be contributing to sort of plug this gap in a way that, of course, we will never be able to plug the entire gap and the kind of shortfall of funds that the sector is seeing, but then also trying to see that where would it be strategic and critical for us to intervene and do some prioritization in terms of how we utilize the limited funds that we have. That said, I think that would be mostly a short-term view of how we deal with the situation. But I think not to paint a very gloomy picture, but I do feel that we are probably not going to return to business as usual. And I think there is a growing realization on that as well, that maybe we might be a little better off, but we probably will not be in the business as usual setup as we were maybe in 2024. Now, given that, I think what we really want to do as a philanthropy is to see how we set ourselves up for the new operating context that we are going to be working in with our partners. And so while there will be some short-term fixes that SIF might think about how we can best sort of prioritize funds to see how we can be filling some of those gaps, like really, and like I said, probably very small portion is what SIF will be able to sort of plug the gap. But then taking a little more long-term view of the issue and of the scenario and seeing that what is it that we can be working in the long term. And a few things, strategic shifts that we already had been making in the past, in the recent past, I would say, in the last couple of years, is actually working more extensively with the government to see that how is it that we can be embedding better data and monitoring systems within the government. So, of course, that effort is humongous as well. And different countries require different levels of support, but every country has some system per se that we can potentially work off. And through our partners, what we are trying to see is that how do we strengthen that effort? And with the hope that if we are able to strengthen the systems, the government data systems, bring more rigor into how data is collected, managed, analyzed, probably there's also going to be more ownership of the data because it is data that is owned by the government, collected by the government, and therefore the findings that come from that data will find more resonance among the government stakeholders. So I think that's sort of the long-term view we are taking. We also hope that by localizing data efforts a little more in country, which are sort of led by the country governments, um, we may also be tackling issues, growing issues around data ethics and data privacy, because that's the other issue that increasingly country governments are becoming wary of in terms of data crossing borders and uh, wanting to keep data more protected within the geographical boundaries of the country. So also thinking that how we can bring in some of that perspective, the priorities of the government in terms of how we plan and think forward for how we sort of do our future data effort. That said, I think as Daniela said in the beginning, that there is some things that the government data can capture, and there are certain things that the government data is probably never best positioned to capture. And I don't think that we've solved that part of the jigsaw puzzle, that what happens to that part. So I think taking a more embedded with the government approach will help solve part of the problem, but will not solve the problem in its entirety. And I think that's something that we still have to, like I said, we don't have a ready a solution already to how we do it, but have been working and brainstorming actively with partners, with like Together for Girls, to see where is it that we can be coming. So not a very helpful response, but I think the newness of the situation just poses a challenge that we were quite unprepared for, honestly. And will require much more brainstorm and thinking. And I think there will, like I said, there'll always be the space that we probably will not be able to fill. And I think that would be thinking about a little more creatively about, and if business as usual is not what we can go back to, or will probably not go back to, uh, I think will be on us to think a little more creatively in terms of how we fill that gap. So instead of doing the same or more of what we were doing in the past, what is it that we will have to be doing differently? And I think that is a conversation that the sector needs to have in a participatory way, to say that given this situation, what is the way forward? So we build it's almost like saying that this is a spectrum of data needs, and this is how it sort of slices up in terms of what is it that the government and the existing government data systems can take care of, and therefore what effort is needed there to strengthen that. What is it that we can maybe with different and more creative strategies fill, and where is it that we just don't have an alternative, and we'll probably have to find resources to continue to support the work in the way that it had been happening in the past. But that's the broad overarching lens in terms of how we are trying to approach this. Thanks a lot, Ashley, and I'll probably turn back to you.
Thank you so much, Stuti, for your incredible insights. And I'll turn it back over to you, Daniela.
Yes, thanks so much. And I'm going to go ahead and close this out just to be, I'm mindful of time. I want to thank everyone for being here. Just phenomenal participation and presentation by everyone. I do just want to acknowledge what Stuti was saying. It's a tough moment. There are a lot of questions about VACS and the future of VACS and funding in the chat. The reality is there are deep disruptions right now to the ability to continue to do VACS the way we have before because of funding cuts. And I think one of the things we're trying to do is make sure that everyone has access to the data that's already available. So 18 plus years of data. So we have that so we can use that. And also, as Stuti said, thinking with our partners and with all of you, what are the new ways in which we can continue to make sure that we're collecting data, that we're innovating, but also, continuing to politically speak of the importance of these kinds of surveys, whether it's VACS or other population-based surveys like DHS. These kinds of surveys are important because they help you to create a response that is evidence-based. And in the end, it's an investment because you're saving money down the road. You're saving money as governments on things like mental health and school dropout and economic challenges. HIV, unintended pregnancy. So instead of seeing this as a cost, really seeing the investments and the measurement of violence against children as an investment so that you're saving money down the road. And so, you know, it is a tough time, but I think there's also hope, and all of you are that hope. I want to close with a quote by Desmond Tutu, seems appropriate right now. And he said that hope is being able to see that there's a light despite all the darkness. So thank you for the work you do. Thank you for continuing to be that light when it comes to ensuring that the issue of violence against children stays on the national, regional, and global political agenda. And an important part of that is, of course, evidence and measurement. And thank you for being here today, and the amazing Together for Girls team, all of our partners and panelists today.